So today we're just going to explore coaching versus therapy. What are they? And how do they relate to children, both in parenting space and in the teaching space? And I just want to start off, I was reading the Commissioner's report from 22 to 23, and some really interesting statistics in it, and particularly how the referrals have risen quite significantly, 91% since 2019. But there was almost 1 million children referred to CAMHS in that one financial year, 22 to 23. Just 32% of those million kids received support, with almost 40% having the referral closed before they saw anybody. The remaining 28 were still waiting after that year. The Commissioner, Dame Rachel D'Souza, talked about needing long-term thinking and action when it comes to children's emotional and mental health and well-being, and providing a space where children can grow up as kids and feel happy and feel safe and feel loved and feel nurtured, living free from poverty, and able to focus on learning. Now, some of those things, we as a community and as a society can help, and others we can't. Living free from poverty, that takes a lot more systemic changes. But there's no reason why we can't support their mental health and emotional well-being. These are the most common referrals to CAMHS in that year in the UK. So unknown was the biggest one. Unknown was responsible for 34%, I think it was. And then the other highest ones were self-harm, anxiety, in crisis, neurodevelopmental conditions, but oddly not autism, and depression. So these are the referrals that are happening through CAMHS, and this is the worry that parents are having and also educators. So what we're going to explore in this session is looking at coaching, counselling, anything clinical practitioners and coaching. We're going to look at coaching psychology and how that potentially could adapt for young people, and also looking at how you can adopt a coaching mindset and exploring the future of mental wellness. So I'm just going to dive straight in with looking at what therapy is. And please be aware that this is broad strokes. So if there are people in the therapy space, I haven't covered everything, but it just gives you a flavour of what is currently out there from the clinical practitioner perspective. So to become a therapist or a clinical practitioner, you do need intensive training and also many hours in the field and practicing. It requires supervision, and you need to be registered with a professional body, you have a license to practice, and you're bound by a code of ethics and conduct. But looking at therapy, it very much focuses from, and again, there's nuances in this, it focuses primarily from the past to the present. So it's looking at that past history, those markers that are challenging you and trying to bring you up to the present day where you're feeling supported and more secure and psychologically safe. They do diagnose disorders, they build treatment plans and heal traumas, and they tend to work with mental health issues, neurodivergence, anxieties, emotional behavioral challenges, phobias, depressions, and lots of other deficit-based challenges. So they're looking at problems. And these are some of the types of therapies that are being used, and these are being used both for adults and for young people. There's acceptance and commitment therapy, occupational therapy, cognitive behavioral therapy, family therapy, applied behavioral analysis, all of these different therapies. So you get a broad picture of what a therapist or a clinical practitioner might look like. So now it looks at coaching. And again, I have applied this from a very traditional stance. And for those coaches who are listening in today, will recognize, well, we do more than that. And we'll come to that in a moment. So coaching, actually, no training is required to become a coach. Life experience is enough for you to become a coach. You don't need supervision. You don't need registration or a license to practice. And there's no real code of conduct or ethical standards to abide by in a traditional sense for anybody to become a coach. It differs in its focus, so that it focuses primarily from the present through to the future. And it tends to co-create with the client. So it doesn't really have that white coat syndrome that maybe a clinical professional might have. It aims to facilitate self-discovery, and it tends to work on understanding yourself, building emotional resilience, intelligence, problem solving, goal setting, action-oriented, empowering self-efficacy. And these are some of the types of coaching that are out there. So there's relationship coaching, life coaching, business coaching, holistic career, performance coaching, also sports coaching, which has been around for a long time, and business coaching and leadership coaching is very, very common, but it's not commonly used for children. So looking at those common referrals to CAMHS, just put in the chat again for me, if you don't mind, which, looking at these, self-harm, unknown, anxiety and crisis, depression, neurodevelopmental, would you think would be more suitable for a child? A coach or a therapist? So 1 for coach, 2 for therapist. So loads of 2s coming in, if you can see them. Okay, and that would be a very good judged decision. I see it depends, yeah. And we're going to get to that in a minute. Like where you going, Petra? So let me take a step back for a moment and just give you a little very, very sweeping broad history of positive psychology. Now, positive psychology is a branch of psychology that was kind of formulated in around 2000 by Martin Seligman and Mihail Csikszentmihalyi. So they both came very frustrated with psychology's excessive focus on negative traits, pathology, deficit, what's wrong, repairing this psychological damage. So traditionally, psychology, you would look at what's wrong, and you would really delve into what's wrong. And counseling has a little bit of that as well. So you look at the traumas, you look at the deep-rooted challenges, and then you try and unpick them and work your way up, building resilience as you go. They're very well tried and tested, a lot of body of evidence behind it, but it doesn't work for everybody. And not every bit works for everybody. So if you think of that array of different types of therapies that are out there, and we have found this working with young people, that many young people who come to see us have been in therapy several times with different types of therapy, with occupational therapy, with dialectal therapy, with lots of different therapies, and nothing's working. Cognitive behavioral therapy is a very common one. Positive psychology looks at what's right with a person, even though it's psychology, not what's wrong. So its focus is different. It's looking at what's strong in a person, it's their strengths. And adding positive psychology and coaching together becomes coaching psychology. And coaching psychology ultimately draws from the concepts, principles, and practices of positive psychology, and also functional neuroscience, and any sort of practice that helps a person thrive. So this is what a coaching psychologist might look like. They do need intensive training, usually up to level 7. So it's the equivalent to a therapist or a clinical professional. They can also go into a doctorate position. They do require supervision. Most of them, not all of them, are registered with a professional body who are bound by codes of conduct and ethical standards. Interestingly, they focus from present to the future. However, they acknowledge the past. They tend to enable, not label. So they see the strengths, the good. They're not coming from a deficit perspective. They're coming from what's strong, where your strengths are. They collaboratively work with that person to support a change in behaviors and share practical tools for a multitude of different positive psychology interventions. And ultimately, they're working to increase awareness of self, preventing and supporting mental health challenges. They support with neurodivergence, anxieties, emotional and behavioral challenges, sadness, relationship conflicts, and all of the other things that both the coaches traditionally offer and some of the elements that the therapist or the clinical professional offer. Here are some ideas of those positive psychology interventions. Now, what you might notice is, unlike it's not a type of coaching, it's not a type of therapy, it's lots of little individual interventions. And what's really interesting about this is that it is process-based. So there's lots of different packages out there, lots of programs, such as CBT, that have many different facets to it. But actually, if you really delve into it, which part of that facet is actually working for the 40, 50, 60% of people that it's working for? So what positive psychology, the future of positive psychology coaching, is taking a step back and looking at what that person needs. It's taken an individualistic approach and utilizing the aspects that a person can change. And if we look at psychology and therapies in particular, there is a variety of, let's say, domains that you can change. So you can change your beliefs and values, you can change your thoughts and perceptions, your feelings and emotions, your areas of focus, your inner motivation, and your behaviors and actions. And that's been formulated from science. And many of the therapies feed into some of those, but not all of them. Coaching psychology allows you to pick and choose which one of these is working for that person's challenges, their unique challenges. So you might have 2 cases of anxiety, for instance, in a child or an adult. Let's say a child. So that child might be presenting with anxiety from having conflicts in relationships in school. And another child comes in, has also got anxieties, but their anxieties are born from a trauma that's happened. They were in a car accident, or their house went on fire, or something like that. So they're very, very different anxieties and may need a very, very different approach. So how do we know, well, which is the approach that we send to the therapist and which is the approach that we send to the coaching psychologist, probably? I don't know. I can't answer that for you, but what I can suggest is that rather than going straight down the therapy route, straight to a clinical professional, we look a little bit broader, a little bit wider, and see what other avenues there are before we subject the child to that. And I just want to bring you through an analogy. And I've used therapy here, I mean a clinical practice, some sort of medical intervention. It could be counselling, it could be therapy, a form of clinical counselling or therapy, or something else. But imagine this fish is a child, and it could be a child at school, a child at home, and they're struggling. So they've got very obvious challenges with their mental health. They're not connecting with their social peers, they're feeling disengaged, they're not their lively self, and they're just missing lots of elements. So this poor child is just a little bit dirty in its fish tank. So we take the child to a therapist or a clinical professional, and they work their magic and they clean the fish. And here is the fish, very, very happy in therapy. And then the fish is put back in the dirty pond or the dirty bowl. And what this is suggesting is we need to help with the ecosystem around the child as well. And when that child goes into therapy, obviously except for family therapy, it's only the child that's having that therapy. And sometimes the parents are not even giving or updated on what the struggles that child is having or experiencing. They don't get the feedback. But they might get back a clean fish, and that fish goes back in the dirty pond. It goes back into the school that's not serving it well, or it's going back into the home with stressed, anxious parents, or struggles with money or finances or whatever that is. So I just want you to sit with that for a minute. What are we doing to that fish, and why are we trying to only fix that child? So for those that don't know me, my name is Zeena Hicks. I am a positive psychologist, and I'm currently midway through a doctorate on the efficacy of applied positive psychology coaching on parents of children with ADHD. But most importantly, I have 2 boys, a little bit more grown up now, but they both are neurodivergent, and they have had challenges in lots of different areas. And I am responsible for that, and also education is responsible for that. But what I reckoned is when my child was 5 years of age and he was struggling, and the school suggested he go and see a clinical psychiatrist, which he did, and he was diagnosed with depression. And we were given things to observe about him and feedback on, and the school were offered some suggestions, but that's it. And I was like, okay, what are we going to do about this? You know what? It kind of coincided with me feeling a bit down as well. Well, quite down. I was slightly burning out. And I thought to myself, okay, well, I need to do something about myself because I wasn't really coping with the situation very well. And I got into positive psychology. And after a while, what I noticed with not doing anything on my son, but his mood, his attitude, his sociability was all changing when I started changing. And it just highlighted how much influence we have as adults or carers, parents, educators around children who are struggling. If we can't take care of ourselves, it's going to be really, really, really challenging to support another person. Now, when my youngest son started growing up and his neurodivergent tendencies were getting more extreme, he saw a psychiatrist when he was diagnosed with ADHD. And they suggested he go on medication. He was really struggling at school. He wouldn't sit down. He was running out every time there was a conflict in the classroom. He was taking medication for 3 months, and he turned to me and he said to me, and he goes, Mom, why am I taking a tablet? What's wrong with me? And I was like, there's nothing wrong with you. But why am I taking a tablet if there's nothing wrong with me? And it just dawned on me, what are we doing to our children? And I'm not saying that medication is bad. It's great for some children and it's very, very supportive. But we were using the medication so he was feeling more settled in school. And that was not the way to go. So we took him off the medication. I said, well, they're expecting you to be in school. That means you're not running out of class. You're listening to the teacher. You're trying to respect the teacher, even though I know that you feel they don't respect you. So he took it upon himself to learn what he needed to do not to take the medication. And it revolutionized him. And it just highlighted on how much control we have, no matter whether you're neurodivergent, neurotypical or not. You have great power in yourself to make positive changes. So I'm suggesting to you, and I know that everybody who is here probably wants this as well, is to be that change maker. What can you do yourself first to be able to support others that need your help? How can we lead by example? And looking at that future of positive psychology interventions anyone can do. You know, you saw that list. There's gratitude, there's acts of kindness, there's mindfulness, there's hope, optimism. There's lots of different tools you can use, and anybody can do it. We don't need a guru. We don't need a clinical professional. We don't even need a coaching psychologist to do them. And this doesn't mean you're going to be able to solve every problem. But if we can upskill parents, if we can upskill educators, if we can upskill anybody who is working around children with these positive psychology interventions that they can use, that they can apply, that they can support these young people, then we're going to find a lot less children needing that clinical support, because we will know our boundaries. The boundaries are, you don't go into deep traumas with positive psychology interventions. You're not looking at the past, you're acknowledging the past. So just consider this as a potential. We don't know how to change the trajectory of ill mental health in young people yet. But I think that this could be a really great start. Let's work on the adults first. And this is what I'm going to do for the next couple of minutes. I'm going to go through 3 ways that you can help support through the lens of a coaching mindset. So ask yourself, are you the knower or the learner? Now, the knower is actually most people. It's educators, it's leaders, it's a knower's mindset. So it draws from your personal experience. So you've got lots of experience teaching, you've got lots of experience, maybe not parenting if this is your first, but you've grown and you're an adult now. So you've got a lot of experience in that and you value that knowledge. So you share it. When in actual fact, with young people, we don't know their brain. We don't know what the society that they're living in. We didn't grow up, most of us didn't grow up in that tech world from birth. So we've got to adapt a learner's mindset, and that's embracing growth, curiosity, and openness to new ideas and experiences. And how we can do that is, and I know you go, seriously, she's going to talk about listening, but actually listening is so powerful. So there's 6 steps in active listening, in mindful communication. paying attention. So that is really listening. That's no phones. And it's really hard as a parent because you're on the go and doing stuff, but giving them your undivided attention without judgment. So that means that even if they're saying something that you know is not true, you're still listening because it may be true to them. And when you've got neurodivergency in there, sometimes there'll be great, amazing stories that you absolutely don't know is true, but acknowledging and listening without judgment, that is really important. The reflection part is about reflecting back what you've heard. So you might want to repeat back some things, or body language. If they've got their head down, maybe you put your head down, gesturing, matching, mirroring that body language and repeating back, okay, so you're feeling sad, you think that nobody likes you, you've no friends, and empathizing, clarifying what they're saying, understand that, relay back that you've understood what they've said. And then you can go into summarizing. Okay, so what I heard, what I've understood is, and repeating back what you think they've said, because sometimes you have got it wrong. No, that's not what I'm saying. I go, oh, okay, help me understand. You summarize that, and then if appropriate, you may share personal experiences that might act that. Something like that happened to me when I was your age. So you're sharing experiences, but this isn't always relevant, only if they're open to listening to that. And that's where you can share resources. That's also where you can share the PPIs. Okay, well, what would it look like if you were really kind to them, even though they're mean to you? And that can open a conversation. And a great tool to do that is using something like the GROW model. Now, if there's any coaches here, you'll already know that. Some teachers perhaps might know it, parents, depends on your world, maybe less so. But the GROW model is a coaching tool. It's not a coaching psychology tool. It's just a coaching tool. It's used in leadership. In fact, all of those tools I've spoken to you about are leadership tools. In fact, when I was working with NCI Business School quite a lot, in leadership training, lots of these tools are used. And when I was coaching a lot of these, I used to, before they would open out these PPIs, positive psychology interventions, and these new strategies on their teams, their huge, big global teams, I would say, why don't you try it out on your kids? And they would go and try these tools out on their children and come back and say, I can't believe that worked. He's never done that. And now he's done this. And go, okay, right. All you're doing is building the relationship. That's exactly what you will do with your team. But you can do it in a familiar home environment where you've got so much love to give. And then you can translate that into the boardroom or wherever. So this GROW coaching model basically stands for G is for goal, R, reality, options for O, and W, way forward. And what you do is basically understand the goal, what you want to achieve. Now, in business, it's what you want to achieve. As a child, it might be their objective. Well, what do you want? I want some friends. Okay. And then you would go, the reality, what's the situation? I have no friends, nobody likes me, nobody will talk to me. That's their reality of the situation. That's where the empathy and the active listening comes in. The O is options. So it's really good to get 3 options. Okay, so what could you do to get friends? I don't know. I could bring in some sweets. Okay, you could do that if you're allowed. And what other options? Oh, well, I could go and talk to somebody because they're usually nice to me. Yes, that's great. And what other thing? Says, I don't know. And you keep on going. Okay. And you try and say, what about something really mad, like a spaceship comes down and give you the power to make as many friends? Oh, yeah, I could do that. Okay, would that really work out? Well, can we think of something more realistic? And you build it so it comes that so they're choosing these options. So we've got some superpower. We've got, in some way, we've got talking to that person who's nice to me, and there's bringing in sweets. So then you get them to the way forward and get them to choose. So what do you want to do? I want to bring in sweets. Are you sure? Do you definitely want to do that? So let's talk about if you bring in the sweets, how would that work? And then they might find that bringing in sweets, well, somebody might take them from them, or they might be confiscated by the teacher. And then they're kind of working this out. Well, maybe I could talk to that boy that's nice to me. Okay, great. Well, where are you going to do that? When are you going to do it? How are you going to do that? And you would talk through all the potential reasons why they might get scared and how to be brave and all of these things. And then they've got an objective. So they're going to take one action to move forward towards what they want. And then it gives you a discussion to keep on going around. So when they've gone and maybe they've talked to the person and they come back that day and say, I didn't get a chance, but that's fine. They got tomorrow. But if they talked to someone and they were really nice, oh, so what do you want? I want more friends. Could you talk to more people? So it's just a very, very simple way of being objective. So that's stepping out of your parenting role or your teacher, educator role, having to manage large numbers, and being as objective as possible to what does this person need, want, how do they view their world, and how can I enable them to be able to take action. Coming back to, we can't do any of that unless we're looking after ourselves, unless we are able to be objective. And that means self-care. It means doing all of the good positive psychology interventions for ourselves. And I'm going to leave you with this, the fish. How can we enable and not label young people in an environment that is also thriving? So this talk, it's about making systemic change. It's about the adults taking responsibility for these young people and walking the walk. If you want to learn more, talk, discuss, if there's anything that is sparked from that, my diary is open. I founded an organization called Positive Education. It works with both parents and educators and children with that triad approach, because if any area of that is broken, we're putting the fish back in the dirty pond. Yes, we need to support the kids, but we need to support the adults around it. And we need to be saying the same language. The parents need to be saying the same as the educators, and the children need to know the language and know the tools and know what to do. And as I said, again, if you want to learn more, book in a discovery call with me and let's discuss it, whether you're a parent or an educator or just want to learn more or have any challenges with a child that you'd like some guidance on.